welcome to the show. It's whānau. Welcome to Big Hairy News for another week. Kia ora and good evening, Chlöe. How are you, man?
Good evening, Matthew. It's good to be here.
Doing well?
Yeah, I'm doing all right, mate. Oh, why is
Box
my
of fluffy
finger doing
ducks?
an autofocus thing. That's weird. Oh, I don't enjoy that. You notice that? It's doing autofocus?
Well, that's just, it's asking, what is it? Looking for my close-up Mr. DeVille? Isn't that the saying?
That's really distracting. I'm sorry, fam. I'll try and murder that.
You feel very low on your mic as well, level.
Yeah,
Chlöe.
they've changed something again, haven't they?
Yeah.
They've changed something.
I've just bumped you up a bit, but hi, welcome. Kia ora.
Hi.
Good to be with you.
It's all going very well.
It's all going very well. Well, whānau, we've got a big old show for you tonight. Dr Gary Payinda is with us. He is currently in the waiting room about to come and join us because there was a fascinating item on Q&A over the weekend to do with how our public healthcare system is heading towards a US-styled healthcare system. So we're going to have a look at, handy that, everything's bigger in America apparently. So we're going to have a look at that with Gary and see if we can decipher the whole thing. Also later on tonight, Christopher Luxon, and to be fair, maybe it's not Christopher Luxon, but there was a report that came out last week that, to be fair, I actually missed, but saying that we're going to have to start to address how we basically pay out when it comes to mass weather events or mass issues. And the government just can't afford to keep paying out all this money when there's a flood. And so Christopher Luxon has said a couple of times today that he is going to have a look. We, the country, are going to have a look as to how long we can continue to kind of pay out when these big events happen. Got some things to say about that. And Pat and Chlöe from February 2024 have got some things to say about that as well, because we highlighted this.
We do.
Well, we highlighted this as an issue, especially when they empty the coffers and have nothing left in the coffers because of tax cuts and landlord reimbursements and tobacco reimbursements to pay out on a weather event. We spoke exactly to that 18 months ago, so we'll have a look at that. And also Chlöe was on, there's a new podcast, I think, on NZ Herald called The Front Page. We should call it I don't know how we can turn it into BHN like they're copying us, but that's what it's called. It's called The Front Page, and she was on it probably last week, and they released it this week, and she had some interesting things to say. Since our family meeting last week, we have had a lot of interaction and a lot of conversations with people. We've had people phoning us, emailing us, and talking about websites, other people emailing who I haven't got back to yet, talking about getting some help with the leftist collective, lots of contact. So really gracious of you all, and thanks so much for doing it. Want to say I have not yet changed the credits to the Patreon. They will be getting done tomorrow. But want to say a huge hello and welcome to Dee, to Joshua Sims, to Tess, to Shayad, to Austin, to Sarah, to Theodore, Andrea, Holly Ray, Sophie Actual, the Jacks, Blinkenstein, and Annalise Ranson, who have all become patrons since Thursday, I think, actually. So thank you for that. We appreciate you. And also just acknowledge that there are several people who have changed their membership levels as well. I haven't got that data with me this very second, but we will be doing that and giving you all the lowdown and information tomorrow, because the sun will come out tomorrow. Actually, it's quite a nice sunny day in Dunedin today, Chlöe. Speaking of the sun will come out. And it's not supposed to really rain again until Saturday. So it's hopefully going to be a lovely, fine week. Nice week to take the dog to the beach, I think. Nice week. So that's us. Lots of things happening behind the scenes. Also, speaking of the patrons, there is going to be a lot of information over the next wee while going forwards and backwards between me and the patrons, because we're going to address a few failures in the Patreon system, namely our/my failures to not take you for granted. So there'll be some apologies coming and some new direction for the next 18 months, because as you know, we are actively planning for the next 18 months leading up to the next election. Alrighty, is there anything you want to throw out there, Chlöe, or get out there at the start of the week, or anything or everything?
So I was just going to say just a very brief comment. Hopefully, we'll touch on this a little bit later on. But the absolute shit show of the Wellington Mayoralty with Ray Chung. Have you been watching
Yes.
that?
Yes. Saying some revolting
Please,
things.
can we speak about that at some point? It
Yep.
is juicy.
I do have it as a story not to highlight tonight, but we can approach that later on tonight and maybe do it as a feature tomorrow night. Yeah, pretty. And ironically, it's just once again, Chlöe, just another brown female who gets it in the neck in a public setting. It's kind of weird how that continues to happen. The other thing which I haven't,
and then an older man completely not knowing what an apology is or how to listen to his advisors or come off with even a shred of humility. We need to cap politics at about 5 years younger than Ray Chung is.
Yeah, I think maybe within politics we do need an age you can vote and then an age you need to stop voting. Maybe that's what we need to start doing. Also, one of the things I haven't mentioned now, but I will mention at some stage tonight, is speaking of shit shows, what is happening in America at the moment with the Epstein list. Just juicier than you will ever imagine.
I mean,
are we talking about Jeffrey Epstein? Epstein. How do you say that name? Jeffrey, what is his name again? I don't even know who this is. So funny.
Trump made a record on Truth Social over the weekend. He got ratioed on his own social media platform for the first time ever.
Getting booed. There's people getting booed at Republican events. There's all sorts of stuff going on at the moment. So we will touch. That's not going to be a focal point for tonight, but we will touch base because it's a fun one. But speaking about the next 18 months, speaking about going into the next election, one of our fellow comrades here now on the, if you are on YouTube, maybe you've seen the change of the name on the Big Hairy Network, which is now officially the name of the YouTube channel, the Big Hairy Network, is of course Dr. Gary Payinda. Gary, welcome to the show. Good to be with you.
Hi guys, how's it going, Pat? Hi, Chlöe.
Hey, Gary.
Yeah, it's going good, man. How are you doing? How are you feeling about life at the moment?
Yeah, no, I had a good shift. We were only at about 110% capacity today in ED, and so that's awesome. We were busy, but not badly overwhelmed, and I felt like we were able to give good care to patients, and so that's a good shift. That's a really good shift.
You released a spectacular podcast this morning. Do you want to give us, 60 seconds on the podcast that was put out today to let people know about it so they can go check it out?
Yeah, we've actually got 5 or 6 now that you've helped me birth out into the world, and these are looking at things as varied as nurse staffing ratios, public sector strikes, what government is doing to cancel the census as we know it and recast it in a different image. So we're talking with professors, emerita, workers, whoever really wants to add something to this conversation and talk about specifics. And so, yeah, I think recently the one you're probably referring to is the talk I had with Odie Mattson, and that was quite incredible. It was a chance to refute and rebuke this health minister called Simeon Brown, who insists on going on Twitter and Facebook and personally attacking doctors and nurses. Very petty, very, very, I was going to say he lies a lot, but what's a nicer way of saying that? Very misleading tweets and sharing of numbers. So we just tear it apart in a line by line from the point of view of a public doctor and a public nurse telling you this is how it is. So hopefully people want to listen to that. It's on the front line. And I think really I would like Simeon Brown to listen to it. So what I would say is we need to have an open invite to that gentleman to come and talk to us at least 30 minutes, because I don't want sound bites. I don't want him doing the usual. I want him to have some accountability and talk with people who can hit back. Yeah.
And as you're seeing in the chat, lots of love about the podcast this morning and the podcast.
Hi, Josie. Thank you.
Gary's podcast is amazing.
I don't know if I'd go that far, but
Mm.
the cool thing is we get to talk about things at some length, and you get to hear the real story. Because if you're just going off of 4-second sound bites, you're going to be woefully misinformed on almost every issue that's essential and critical for the public to know about.
All right. Let us get into this conversation. Now, I don't know if you know them personally, but we're going to have hear from Dr. Phil Bagshaw and Dame Sue Bagshaw, who I believe either both are, or Dr. Phil is the founder of the Canterbury Charity Hospital. I don't know. Do you know them personally? You certainly have an opinion on them. Do you want to tell us?
I don't know them personally. I just have revered them for about the past 18 years since I've lived in here. Yeah, Phil Bagshaw is a general surgeon and, like you said, started a charity hospital because he described a gap between public and private that many more patients are falling into. You know, a lot of people get knocked off waiting lists now in the public sector and can't even get on them. And so he basically said, we have a lot of people dying of colon cancer. I'm going to start endoscopy, and it's going to be a charity hospital, so supported by donations and with services free to the public. And it's huge now. Like it's open every day of the week, and it's doing hernias and all kinds of general surgery, endoscopy, and a whole bunch of other stuff. And his wife is this amazing woman who I think is a pediatric specialist in adolescent medicine. So that too, like these people did not go into it for the money. They are in it to help the public. I have immense respect for them. These are the best people, the best doctors.
So let's get into this conversation, and it's so exciting to have you with us for this, Gary, because then me and Chlöe can just shut up and you can spit the truth. So as everybody knows, Gary, I'm sure you know as well, what we typically do is we play a few clips and we have a bit of a chat about the clips and we go through what we've heard. And there is so much more to this interview than even we're going to show, including, Gary, you're mentioning what incredible people these are. Actively, Dr. Phil actively going, I would like to make my charity hospital obsolete. They don't want it anymore because they want the system to be working correctly. But they start with the conversation around New Zealand moving towards a US style health system. And Jack just asked them quite simply, what are your concerns?
Well, we're concerned that the Minister of Health wants to offer 10-year contracts to farm out non-urgent surgical care into the private sector. And we think that's a very retrograde step.
Why?
Well, there are a whole load of reasons, but it will mean there'll be less money for the public sector. It means that the doctors will gravitate into the private sector. There will be no teaching or training. For lots and lots of reasons, it will mean the public sector will go down as the private sector goes up.
One of the points they made in this conversation, Gary, and I mean, obviously it's obvious when you think about it, but I never thought about it. All of the training happens in the public sector. All of the training for new doctors, all of the students, and it happens in the public sector. So if you're weakening the public sector, you're also damaging the future of the New Zealand medical institution because nothing happens in the private sector. Your thoughts about what he had to say there?
He speaks the truth. So I want to point out to you that something he didn't mention, but an incredible condemnation of the way policy is being run. A public hospital trying to do the right thing for patients has an annual budget and struggles to try to put programs in place beyond that. The answer, if you want to hire more nurses or you need more resources, we don't have money. And it's outside our funding window. We can't give you that money or give you that assurance. But this government, if you are a private hospital corporation, an Australian multinational, like the one that owns White Cross, they're willing to give them a 10-year financial contract. They're willing to give blood-sucking private corporations a 10-year guarantee on public taxpayer funding, our money, and they will not even give the public system a 1-year guarantee that we will have enough staffing a year from now. Now, that can't be done. It's mind-boggling the amount of wool that has been pulled over people's eyes when they hear this stuff. They think, oh, a 10-year contract, that's no big deal. When you understand how incredibly favoring that is of the for-profit system, you just realize that this is just effed up. It's just beyond belief.
So what you're basically saying, if I understand you, is, you guys sitting there in the hospital aren't quite clear on what your funding will be at the next budget. So you can't plan past beyond that, whereas these guys are given a green light for a decade to be able to do exactly what they want to do.
Absolutely. I'll give you a very concrete example. We keep being told in my town that we're going to have a hospital built and it's coming soon. 2032, it's supposed to go operational. But the money for that, for the final stage, like tranche 3 or whatever it's called, stage 3, where they actually build the wards, the patient towers, where the medical and surgical patients will stay overnight, like i.e. the hospital.
Yeah.
that has, the money for that has not been appropriated yet. It's not been guaranteed or set aside. So we are literally being told we're going to get a hospital, but the money isn't quite there yet. And these private hospitals, which are popping up all over the place, private ICUs, $100 million refurbishments and doubling and expansions. You read about it literally on an almost weekly basis. Yeah, there's one. Dunedin, Christchurch, Auckland, massive expansion in the private sector. And they are getting a 10-year contract. It is just turning decency on its head. It's.
There's a story that we're not going to feature tonight, but it might be a time to speak to it if you want. Is an exclusive to One News about Nelson Hospital. Now, I'm kind of clear on what they're saying, because apparently there's a guarantee people will be seen within 2 years. And it appears what they're doing at Nelson Hospital, now I'm a moron, so I'm trying to get this right, is they're putting people on a list for appointments where there's no appointments to be had. And it says on the documentation not to notify the patient. So what it means is then they're in the system within the 2-year period, even though they don't have an appointment. So they don't tell the patients that there's an appointment, but they put them in the system for an appointment, which means then they're in the system. If it takes them another 3 or 4 years to get to them, they've had the first appointment within the first 2 years. Are you highlighting that, Chlöe? Is that as it reads to you? That's how it read to me on the news tonight.
Yep.
So do not contact patients. So the patient has an appointment. They're in the system. Technically, they're in the system to be seen, but don't tell them they're in the system. And that means that we fulfill the criteria of 2 years by this government. It's just weird. I mean, I don't know I know you were working this evening, Gary, so you may not have heard about that, but if you've got any thoughts around that, I'd love to hear them.
No, but I mean, there's a long history of giving patients a ticket to nowhere, putting them on a list that dematerializes. I mean, just today, this thing, the Specialist magazine, I guess you'd call it, it's put out by the Public Doctors Union. It talks about how the private sector was given an enormous contract, crazy money, to go through patients and decide what their priority would be and who could get seen in public and private. And they ended up sending 68% of the people on that urology surgical list back to their GPs to start the process over. And the reason they used is, from the time these poor people got on the list to when they were reviewed, the criteria had changed. They had made everything harder. And so these people could be summarily dismissed, just knocked off the list and put back to a GP. That's a very effective, if evil, way of dealing with a waiting list. You change the criteria and you ensure they never get a fair hearing. They never get to see the urology specialist. They're just off of it. And it's just like what you're describing. It's giving people a ticket to nowhere, smoke and mirrors. We're pretending we're dealing to the problem, but we're not. There's nothing there. There's nothing of substance there.
Ironically, and that's exactly what they did with the Equal Pay Act. It's exactly what they did. They changed the criteria, then they cancelled all of those equal pay negotiations. Then, you guys can start again now. It's exactly the same.
They raised the criteria to 70%, knowing that, like, I don't know, many of those groups were at 65, 68% female predominance, and they knew they wouldn't qualify. It's almost like they set the number on purpose to exclude the majority, which is frankly probably what they did.
Let's get to the next clip. So we still get these guys in who are amazing. Dr. Phil Bagshaw. Jack asked about how does what we have, like how does the system now start to move towards a US system? What happens?
Well, it becomes more and more focused on the sort of neoliberal philosophy, where hospitals are there to make money, and we purchase health. That's the notion. It's a commodity. Now, health is not a commodity. Health is a common good. And unless we focus on fulfilling the common good, then what happens is we end up solely focused on the money. And that's what an American system does.
You say that this trend has been in place since the late 1980s. How so?
The trend started with Rogernomics. That was the first hit. And then the really big hit was 1990, when we had the mother of all budgets. Both of those really started to take all the resources out of health. And progressively since then, the public system has been getting less and less resources.
Clip number 2. Chlöe, you've been quiet so far. Do you want to say anything? And then, of course, Gary.
I'm quiet because I've been seething. Yet another very smart, very motivated person pointing out that the fucking wheels came off thanks to Rogernomics and the mother of all budgets. And this government seems to be looking at those two particular eras as just a gold mine of great fucking ideas.
The gold standard.
Brilliant. Never been a bad idea out of that time period. These 10-year contracts, the first thing that jumped out to my mind wasn't about patients or that sort of thing. What a great thing to put out in a prospectus to your board members, to your shareholders, that we've got a funnel for public money secured for the next 10 years. Please buy more shares.
Exactly.
First thing that sprung to mind.
Precisely.
And this government has so many links to private healthcare. It's stacking up their portfolios. You know, you got Shane Retty, like it's half shares in a couple of private clinics and that sort of thing. Like, it's so bald-faced, out in the open, fucking corruption that is really rustling my jimmies tonight. And it's healthcare. It's something that affects every single one of us. And if they can lock down 10-year contracts, like, you know, government terms, 3 years, 4 years?
Exactly.
And they won't have they won't be able to do that without getting sued to oblivion for breaking the contract. Yeah, it's bullshit.
They're creating problems that won't be fixable for a generation.
Oh, yeah, that's heavy to hear, and you are exactly right. But I didn't want it verbalized quite like that because it's like a gut punch. Oh, yeah, generation of having our healthcare system like destroyed on purpose, just crashed into the ground. So people
But
can
always remember, it's going to help some people. Like, you may not like it, a pensioner may not like it, but my God, if you are in private radiology, private telehealth, private surgical centers, private hospitals, private health insurance, these are the best times in history, probably. The amount of money, when you can privatize public services, the amount of money is incredible. And and it's worth remembering the way you do that is to defund and destabilize first. So you get people antsy and desperate so that when you come along and say privatization is the only answer, lots of them will say, well, yes, I do need care. I'll take it wherever I can get it, even if it hollows out and erodes the public sector. And the public sector will be much weaker when I need it in the future. So this is they're winning. Just no doubt about it. They're executing very effectively their program, and it's working. They are privatizing by the hundreds of millions. It's really incredible. Like, we're not like beginning down that path. We are already far down it. And I'm not at all convinced. I mean, I do these shows to try to raise awareness. I'm not at all convinced that with anything short of outright direct action by hundreds of thousands, that we're going to be able to salvage essential public services in New Zealand. We are becoming a two-tier country of haves and have-nots. Yeah, I mean, look, outsourcing doubled to $350 million. These are not small amounts. And while the people in our departments would like to know if they're going to be if there's going to be jobs for them, if there's going to be a new MRI machine in the future, if our hospital rebuilds are actually happening, or whether that's a bit of a smoke and mirrors thing. Meanwhile, again, privates are getting 10-year guarantees. So this is, it's almost set in stone, and it requires a repudiation so vast that we cast the people doing these policies back under the rocks where they belong. Like, these people have climbed out of the ooze in order to rob the common good for private profit, and they should just be sent packing. And that's my hope, is that more people see what's going on and get angry.
There's a part of the conversation there, Dame Sue Bagshaw talks about a quarter of New Zealand can't access GPs. Let's just get to that part of the conversation, and then we'll continue with our little chats.
Well, when you live in a country where a quarter of the population can't access a GP, that's something to worry about. And when you live in a country where many general practices are now being run by commercial companies, that's something to worry about, because they're there to help their stakeholders. They're there to pay their share holders.
But again, it comes down to a question of efficiency. And I go back to those numbers.
When you have managers in charge who don't know about how to deliver health, all they care about is how much it costs, you're going to get inefficiencies.
Right. And so
it's guaranteed.
Are you suggesting that the health services and an increasing bureaucracy in public health services are to blame for that massive expansion spending and a reduction in services?
Absolutely. The private sector is run by doctors and nurses, and they say when they can do the operation and what operation they're going to do. Not in the public system.
So the private sector is more efficient?
Only because it does very small cases with least complications and least complexity, if you like.
And the public system is there to pick up the problems as they arise.
So a decade ago, 98% of patients waited less than 4 months.
That's the next clip we'll go into. But that, Gary, made me think about when you've talked to us about giving $50 million to the private sector. They pick out all the easiest surgeries, they do those, and when those surgeries go wrong, they end up back in the public system anyway. Seemed to be what they were saying.
Absolutely. And so Health New Zealand data, New Zealand government audits have shown that the least cost-effective, most inefficient thing you can do is outsource your cases to the private sector. International literature has shown that you get worse outcomes, higher morbidity rates, higher complication rates, higher death rates when we're comparing apples to apples. But the thing to remember, that's in the private sector. The thing to remember, though, is we're almost never able to compare apples to apples, because these privates, they don't take my patients. They don't take the sick person with diabetes and high blood pressure who's had surgeries before and who's complex. They don't take acute cases and emergencies. They do the most profitable things. And so if you've got a quick flick, maybe a cataract to do, they're there for you. As soon as that patient goes bad, so they have a complication, they're out of there. They are shipped off to the public hospital. So the private hospital keeps all of the profits, and they outsource all of the damages and cost and trouble to the public sector, to the taxpayers. It's a rort.
That's the classic big business model, though. You privatize the profits and you socialize the losses. I mean, you think about anything like the American car companies that were going to go bankrupt. They lost all that money through the global financial crisis. It was the government that bailed them out. They socialize their losses and get help from us, but they keep all the profits themselves. That's not just a practice within the health system, but within lots of business, unfortunately. Chlöe, do you want to add anything to that before we go to our next clip?
Look, can we just make these two the head of the health sector? Just somehow just give them the keys to the castle and just let them have at it, because I have infinitely more trust in these two based off these clips alone than I have with anyone at Health New Zealand at the moment at the top. Like, if they want to try something radical, let's do that. Give them the budget and the ability to change.
The other thing they did, Chlöe, and we're not showing all of it, but we do have an example here, is when Jack came out. We like Jack. We like him knowing his facts and figures and his numbers. And when he brought some numbers out, they actually laughed in his face, going, those numbers aren't right. And he's like, well, these are the numbers in the budget. And they went, yeah, but they're not right. And this is one of those examples. They talk about I've written down waiting list lie. So Jack uses information about the waiting list, sort of, bad Labour, pre-national, back in the days 10 years ago. And they just kind of go, yeah, no, that's not true. So not only did they have interesting ideas, they also smashed a lot of what they said was incorrect numbers through this conversation as well.
98% of patients waited less than 4 months for elective surgery.
No, they did not.
The waiting list figures are an absolute nonsense.
Today it's 57% according to those numbers.
Now they're counting them. Before they didn't.
Right. you dispute those figures?
Oh, yeah. At one time, there was a very simple system in New Zealand. Your GP thought you needed to be seen in a hospital. Your specialist in the hospital thought you needed an operation. You've got your name written on a list and have an operation. Now, you go to your GP will go to the computer, and the computer will say, no, we're not doing that right now.
So, Phil,
So there's a little clip there. So laughing in the face of, and they did it in previous times in this conversation around budgets and how much is spent, etc. as well. But the waiting list lie, how it wasn't amazing 10 years ago, because these are all new numbers. Any thoughts, Gary? Any light to add to that shade?
I mean, like any numeric target, it can be gamed. We're gaming these numbers every day. I mean, we see how that works. But just a simple thing with the waiting list of changing the criteria will knock off thousands. Saying that a person has been on a waiting list too long and knocking them off for that reason. So what they'll say is, oh, you've been on this list, or you thousands of patients have been on this list for so long that maybe your condition got better. Maybe you don't even need it anymore.
Is that how it works?
So we're going to put you back to your GP to force you to go through the system again to see if you still need to be on it, because it's taken us this long to get to you. So there's a million ways to skin this cat and to fake the waiting list numbers and almost anything else. There's lots of ways. Yeah, I could go into them for you, but that's a separate conversation.
Maybe what we'll do, Chlöe, is just roll straight into the second one, because I know your little socialist heart will love this conversation, because like any good interviewer in this day and age of neoliberalism and profits, Jack wants to know, but where's the money coming from? And they just give a straight up answer.
So
Incredible.
if it requires a huge financial input, and I've described the financial input of just over the last few years that perhaps hasn't been met by an increase in services, where does the money come from?
It has to come from the people. But, 1% of the New Zealand public own the country. I mean, the billions of dollars. It's really interesting. Money is one of the few things in the world which defies the laws of gravity.
This is great.
It floats up. Under the neoliberal system, all the money that you're talking about has been floating up to the top. And the bottom 25% haven't really got enough money to live on.
So you're talking about more borrowing, or are you talking about higher taxation, or are you talking about a combination?
Higher taxation and, I would like to see a big wealth tax, personally. The problem with wealth tax is the very wealthy hide all their resources.
Do you think there is an appetite in the New Zealand public for what would be quite a radical shift when it comes to tax and redistribution in order to fulfil what you see as a better healthcare system?
I think if they felt their taxes went into health and nowhere else, I think there will be more. There was a survey done not that long ago saying, would you be prepared to pay more taxes in order to have better health system and education system? The vast majority said yes, so long as they know where it's going. At the moment, we pay our taxes, we have no idea where it goes.
There you go, Chlöe. You said, can these guys run the health system? Maybe they should run the whole country. I don't know, it's a thought, Chlöe. You want to have a go at it, sir?
Oh, yes. Don't look. Everybody knows what the answer is, and it is tax the wealthy. And we can look at the evidence, and the evidence is we used to, and things were better then. We had wonderful top of the line hospitals. We built them from one end of the country to the other, all at once. Like, how did that happen? Now we're going, well, Otago, you could have a hospital, and Nelson could have a hospital, but not at the same time. Here's a knife in the arena, fight for it. Like, this is the thing. All they've got is the wealthy turning around going, well, if you try and tax me, I'll hide it and run away. So we lose nothing. They're getting away with it now. And we're just quibbling, and everybody's going, oh, well, we don't have any money. There is. We have the tools to do it. The tax system needs to change, and the health system needs to change because it has a huge influx of money. They're exactly right. No one's going to argue about money going into the health system and money going into the education system. Nearly every citizen of this country interacts with those two systems. We can't see them being starved of funding, starved of resources, starved of productivity, moving forward and all of that sort of stuff. We can all see it. It's just that our current government is going, well, we just don't have any ideas. We haven't tried anything, and we're not going to, but we don't have any ideas. I guess we'll just have to keep cutting things.
Gary, that's the end of our clips. Love for you to sort of wrap up what we've been seeing and hearing from these two amazing New Zealanders.
Yeah, how do I summarize or give proper credit to a guy that says health is not a commodity, it's a common good? There's nothing I believe more about health than that. Health is not a commodity, it's a common good. And when these people, these businessmen, so-called businessmen like Christopher Luxon, say that it needs to be run like a business, you've got to push back. And none of the mainstream media does, because they're being run like businesses, right? Their public quality of public media is that it's basically being attacked and destroyed, no different than hospitals. And so we don't have anyone really pushing for the common good, at least not in a concerted way. And so when you hear common sense from these two senior doctors who spent a lifetime helping people, it really hits home. It is a common good. It's something that we did do before. So in my neck of the woods, we had 12 beds per 1,000. We now have something like 2.6. This is like 40 years ago. We were doing better building hospitals and supplying hospitals to our public. Think of my hospital. Parts of it now are 60 to 70 years old and really falling down. That was built for a population that was less than half what it is today. Yeah. They did a good job of building things back then and building them to scale. in a way that we just cannot, because it's always about austerity. But remember, it's always austerity for the poor and the average and the working class and pensioners and students. It's never austerity for the corporations, right? It's a 10-year gold-plated contract for an Australian multinational that owns our urgent cares, right? They don't have austerity. There's no money to hire nurses, right? We know that 10,000 nurses in a year got their Australian registration, right? It's catastrophic. So they can brag about having increased numbers of nurses hired, but if you are hemorrhaging them, it's like putting a Band-Aid on when your carotid artery is severed. We are losing them at this insane record rate. I think that was a 53% increase from the year before, over 10,000 New Zealand nurses getting registered in Australia. That's an expensive process to do that, and time consuming, and you don't do that lightly. You do that when you're ready to bail, or you have bailed. And I mean, that's what we're seeing. We're seeing just widespread degradation, but only for some. Remember, this is a time of great profits for the private sector. And if ever there was a time for you to invest in private healthcare, it is now. Because if these, I'm not even joking, like this is the time for Shane Retty to buy even more shares in Kensington Private Hospital and Surgical Center, because it's going to go like gangbusters. They have guaranteed hundreds of millions of our taxpayer dollars now being guaranteed over 10-year time periods. And with gleeful abandon from Simeon Brown, saying he wants to see all elective surgeries privatized. These people are telling you what they are doing to you, and yet we somehow think it's okay. And I do want to say the two most common things people will say, but isn't it good that I can get my hip done in private? And indeed, sir or madam, it is good that you can get your hip done faster. But what you have to realize is that 70% of the doctors in private came from public. They were enticed out. And these millions will only cause a hollowing out and, again, a hemorrhage of anesthetists. That's the largest number of a kind of doctors that we are losing from public and into private are the anesthetists, because they have a marketable skill they can take into private that will be highly reimbursed. And it leaves our public system screwed. I don't think you understand, you guys understand, but I don't think the average public person understands that, yes, you're going to get your first cataract. So they'll do your left eye in private. But when you return to the public system because you have an emergency in your right eye, you are going to be stuffed. The surgeons and anesthetists will be gone, and they don't come back from private, right? They're getting paid well to cherry pick cases and do the least sick, least complex, and most profitable ones out in private. I mean, this is catastrophic on every level, and it goes deeper and deeper and deeper. I could sit here for hours and talk about it, but I want people to understand that when you applaud the hollowing out of the public sector, the shifting of, in just one case, $350 million that could have gone to build your new surgical theaters at your hospital, that money has gone to private. And what will happen is you'll end up with now I came from the US 20 years ago, 18 years ago. So I can tell you what happens. Private gains a monopoly. When they become the only game in town and your public hospital is the place of last resort that no one wants to go to because it's just crap and it's dysfunctional and nothing works there, then you've created the right circumstances for privatization. Public suffering drives privatization. It drives private profits. And what you're going to see is a monopoly, just like our monopolies in our energy companies, just like our monopolies in our supermarkets, just like our monopolies in our offshore banks that, again, we're hemorrhaging money abroad. We won't see that money again. In fact, in most cases, we don't even collect proper taxes on it. It escapes. And that's what we're now seeing in healthcare. This is a time for the robber barons to be moving into New Zealand. It's a small market, but it's a profitable one. And whenever you see the words private equity or venture capital attached to your healthcare as a citizen of New Zealand, you know what will happen to you. You will be predated upon. The vultures are out, and you are not a patient who deserves care. You are their next meal.
Well, Gary, it's always so cheery to talk to you with the lovely, nice words we get out there, he says, with his tongue held firmly in his cheek. No, in all seriousness, thank you for being a part of this tonight. Thank you for coming on board and explaining, clearly and accurately what we need to do and what we need to be aware of, because, if we want to do anything about it, there's an obvious thing that needs to happen in about 14 months from now. This is a systemic problem, obviously. The health system hasn't been broken in the last 20 months, but I think most people would say that jet fuel has been poured on it in this last 20 months.
Exactly.
So we need to see a result in about 15, 16 months from now that might give us a chance to save what we can save. You say it's going to be a generational issue, but maybe if we have a change in leadership, there can be some kind of pullbacks. I'm not sure.
That's the bare minimum. But waiting 14 months or whatever it is for an election is not enough. People need to understand what's going on. So that's where shows like yours become so important. And they need to understand that they can take action. These people are dependent, these politicians that are doing this, who will never end up waiting 7 hours in my emergency department to be seen by a doctor, right? They have private health insurance. They have private hospitals that are just getting bigger and bigger and bigger and having their own ICUs now. These people are not like us, and they do not like us. And so people have to get out now and start protesting. And if you've got a pot, take it to your local MP and start banging. They must be named and shamed. And this is why I'm doing the frontline thing with nurses. Every single bullshit, lying quote that these guys put out on Twitter and Facebook, Simeon, Lester Levy, Retty before him, the whole coalition of jackals. Every time these people speak, it needs to be thrown back in their face. We need to be united. We need to ensure that we're part of a union, because without collective bargaining, you are defenseless. You have nothing. And the nurses need to get with the doctors, need to get with the patients, need to get with the beneficiaries and the pensioners to say enough's enough. It will not be tolerated, and it stops today. And casting them out in 14 months is not enough. They can do so much more damage in 14 months to enshrine their changes, collapse the system. I mean, this is arson. You don't look at someone that's about ready to burn down your home, to burn down your public library, to burn down your hospital. You don't look at them and say, we're going to give you another 14 months to set the fires. You stop them.
Gary, thanks for joining us tonight. As you've just noted as well, people can find you on the front line at the moment. Episodes are going out Mondays and Fridays. We'll see how and if that continues on what kind of scheduling, but that's what's happening at the moment. Always a pleasure to have you. Thank you for making some time this evening. And I guess we'll see you Friday morning for the next episode of The Front Line.
Always a pleasure to be here. And I just want to say, like Phil and Dame Sue Bagshaw, you are the shining lights of medicine in New Zealand and have been for a lifetime. Thank you so much.
All right, Gary.
And thank you too. Thank you guys.
Cheers,
See
man.
you.
All right, Joey. Let's. Have you got any thoughts you want to put at the end of that before we go to the super chats and stuff?
I keep coming back every time we have Dr. Gary on the show that his energy and fire for wanting better.
You're ready for war? Are you picking up your weapon and going to war?
Yes, I will meet you at the barricades. Like, that's the energy that we need to sustain and bring into the next election. And that is the energy that we need to take not only to the current government, but to our opposition parties, that they need to meet us at that level. I don't want like another another party to get in, become the government, and then sort of wring their hands and go, oh, well, we can't do anything about what the other guys have done. Like, no, burn it all down. Burn it down. You know what needs to happen. The only thing that I can hope for here is that the new government after the election has such a strong mandate that they can't not recognise it. There has to be a mandate for major systemic change, because I'm unsure whether Labor can recognise it when it's sitting in front of them, because they didn't last time. But certainly with a strong enough Greens to Pāti Māori section of that vote, maybe they won't miss it.
Yeah. So good to have Gary on then as well, because we could have commented to those amazing comments made by Phil and Dame Sue Bagshaw, but you know, Gary has industry knowledge, and it was very good to be able to throw him the ball and explain and expand.
Talking about the funnel of public money into private hands, like the example that we have here in Dunedin with the hospital build is the current government is crying like, yes, we've reviewed it all now. We're going to build the thing that we always had to build anyway. But it's not filled. Like, they'll build the building, but they won't fill the wards. They will build the rooms that are needed for the scanners, but they won't buy the scanners to go in the room. They'll just say that they'll go and do that later. And it's just like, well, every couple of weeks, I walk past a private PET scanner truck that's plugged into a public hospital building. And I'm just like, well, how much does it cost for that truck to be there? Yes, it's obviously needed, but that's money going into a private hospital's bank account every time it happens. So why can't they go, well, maybe we just buy the thing and look at the money that we save by not having this truck come by, and then eventually you pay off the machine? Because that's, like, if you're talking about running healthcare as a business, that's kind of part of it, right? You buy a new piece of equipment or a new piece of plant. It makes things more efficient. You're not paying money to an outside contractor. And eventually you go, well, that was definitely worth it. Isn't that thinking like a business?
Yeah, I also just think as well, there seems to be such an obvious disconnect, or maybe it's not a disconnect, but, you know, when you remove that profit margin, so you've got your costs, and then you've got your patient, but in the private sector, you've got your costs, and then you've got the profit margin, and then you've got the patient.
Yeah.
Just removing that. I mean, like, put it this way. That would mean that money that we're giving to the private sector, we should be able to pay our doctors and nurses more. Because if we're giving the private sector enough to also fill that profit margin, then why don't we just allocate that profit margin to the doctors and nurses in the public sector? And it would be costing the government the same, and we'd have more doctors and nurses earning more, staying around, not having 10,000 nurses register themselves in Australia. If they're going to pay, if the operation and the time and all that's $100, and the profit margin's $50, then that means they've got $150 to offer back to the doctors and nurses, rather than the profit margin on top of what they're paying over the way. Anyway, I don't know. I'm a moron. I don't know what I'm talking about. Let's get to some super chats. Kaimātara, privatising everything like health is the logic of capitalism. Its consistent need for expansion and growth requires it to engulf non-capitalistic places. Holly says, late fee, loved the interview with Odie Matson. That's from Frontline this morning. Again, Kaimātara says, its expansion depends on disrupting and reshaping non-capitalistic areas to survive, but in incorporating them, it also destroys them. Raijin says, Gary for Health Minister, Craig for Finance Minister. I guess that means, Chewy, then you're Prime Minister. You've got it. It's finally...
Well, we all knew it was
path.
heading in that way.
We did. And then you can socialise everything. You can socialise everything we own. There we go. Citizen says, Oppo parties need to announce 90% tax on profits of the private hospital industry. plug tax loopholes, earmark the money to fund public health sector. Do you think we need our own Luigi from Ryzen? I don't think we're going to answer that one at all in any shade.
I love Mario
or
Kart.
form
I love
at
Mario
all.
Kart.
Peter Sim says 40 years of neoliberalism, Nats. Trust us, it'll work out, or it'll work this time. Agreed. Emphasis on the this time. Kathy says the public system also forces people into private sector by denying procedures. I'm a cancer patient being denied reconstructive surgery. Yeah, I mean, I guess the other thing to make really clear is, I mean, like, we're not the experts, but I don't think anyone here is saying that the public sector is getting it all right. But I would think surely stopping diverting money to the public, to the private sector, might give the public sector a bit of a chance to sort some more of those things out, perhaps. James says, did you guys see Gary Economics in the UK is back? Yeah, I saw that today, actually. I watched the first half. He says everyone over there is talking about a wealth tax before and 75% support for it. Really interesting commentary going on in the US. And it's talking about populist politics and what's happening with Trump at the moment. The brosphere, the podcast bros, that kind of stuff, who went with Trump because he was populist and because they're all a bit thick and they think being cool is better than being effective, and that Trump was cool and Kamala wasn't. It's all blowing up in their faces now. They're all turning away from him. And with what's just happened with Mamdani in New York, there's a wonderance in America. And it doesn't mean it's a good thing, because a swing to populism might be temporary, but we might be about to see a really strange swing to populism in America, which is the socialist angle, because Mamdani is doing things like saying, well, we need to live in New York. I'm for New York. We need to be able to afford to live here. He's being very New York centric. You know, and it's working because, strangely enough, the people of New York want to have their New York problems
they really like that.
solved. Yeah. And when he gets asked about how long until you go to Israel, and all of the other candidates say, well, really, really quickly, and he goes, well, I'm not going to go to Israel, or I'm going to stay in New York because that's the job. I'm working for the people of New York, and maybe I'll just connect with some of the Jewish community here in New York. So look, I'm not saying all is forgiven from some of those podcast stuff, but Mamdani is being seen as a populist now, obviously. I mean, it makes so much sense to us, and it'll be really interesting to see what happens in American politics with that swing. The unfortunate thing for them is they've got 3.5 years to go with Trump, or if the event happens, Chlöe, with Trump's replacement. Mike says, we also need to stop thinking in terms of surgeries and hospitals only. Privatisation of GPs, imaging, dentistry, blood tests, mental health, chemists, etc. need to all change back to being public. Another one from Kai Matara. You don't feel your chains till you begin to move. Deep. Right-wing slopulism, left-wing populism. Yeah, I think I've told you this before. I've been involved with an exercise where all of the political parties get stripped off their literature, and all you've got left sitting in front of you is the policies. And the right does not get much of a look in, even amongst a group of people who actively say, well, they're kind of centre-right voters. If you take all of the branding away and you just lay all of the policies out in a neutral kind of way, left wins hands down every time. Every time.
Because it's politics of the people.
Yeah.
We're all people. Even the rich bastards. Even the business people. They're all people. Yeah, I know. The closer you get to the B word, the less of a people you are. Look, I just wanted to round off, since we've had so many looks at just heartwarming health stories. Here's another one.
Yeah.
Auckland ambulance patients being diverted to non-hospital clinics because the hospitals are too under pressure. I guess once the clinics get overwhelmed, you might get dropped in a McDonald's. I don't know.
Here's the thing. Talking about all those hospitals being built around the same time, the 50s and 60s, 50s, 60s, 70s. Do you remember, I can't remember who we were talking to, but it was a conversation that came up to do with immigration. And basically for every 100,000 people in New Zealand that immigrate here, you need another hospital or the capacity of another hospital. So we could well be 10, 15, 20 hospitals behind at the moment. And they're still blimmin' arguing about the right scanners in the right rooms in Dunedin, you know, or what's happening in Nelson or Whangarei.
Or Simeon Brown's been talking about a different type of hospital, because fucking why not throw darts at the board at this point? Talking about modular village-like hospitals where they just kick you out even quicker. It's like, no, I think we've got a pretty good handle on what a fucking hospital is, Simeon. How about we just build them rather than dicking around with reports you've already done?
Hey, Chewy, do this with me and I promise you'll feel better. Big deep breath in. Big deep breath out.
It's Chloe.
Feel better? A little bit?
Is that how we summon her?
Yeah.
I would breathe more if that's how that happened.
Yeah. I know if you say Winston's name 3 times in a mirror, he turns up behind you.
Remind me about Winston at the end of the show.
Love to. He's my favourite topic of conversation. Not. So this is, I don't know if this is a new show or not, but I came across it today. It's on the NZ Herald platform. It's called The Front Page.
Front Page has been around for a while, but they're sporadic.
Yeah, okay. Chlöe Swarbrick was on there talking about the ultra rich and what's next for the Greens. And of course, as we've just done with that amazing couple, the Bagshaws, one of the questions is always, how are you going to pay for it? So Chloe is talking, and the Greens are talking about free ECE, free dental care, free GPs. And the host of this show asks, how do you pay for it? And that's where we're going to pick up.
Yeah, so the party's promising, you mentioned free early childhood education, free dental care, free GP visits. I mean, what do you say to critics who find all of this to be fiscally unrealistic?
I'd say that if we were advocating for or fighting for free compulsory education or free hospitals these days, would be called the exact same thing. It'd be called wasteful spending, would be called Marxists and all the rest. Come at us. The reality is that we've done...
Come at us, bro. We'll have you. Have a crack.
Fight me.
Really big things in the past. In the 1930s and 40s, after World Wars and the Great Depression, we came together as a country and decided to build a nation which looked like the foundations of public healthcare, public education and public housing. And we paid for that responsibly by higher taxes on those who had profited handsomely during a time of hardship for many. Right now, we're in a situation where the top 1% in this country hold 23% of all of the country's wealth. And IRD research from 2023 told us that the top 311 households pay an effective tax rate less than half of that of the average New Zealander. It's not fair. And when are we going to be able to have a rational political debate about how we fix and change these things? I mean, there's a reason that the Conservatives on the other side of the political debate are not even willing to engage in the terms of this debate. They simply...
That's interesting how you think about that. They won't even have the debate, let alone rebutting the debate for obvious reasons. What we were just saying with Mamdani, this is the popular view. Now, it may not be the popular view amongst a very small select of very loud right-wingers, but amongst the population, this is the popular view. So, of course, the right's on a lose-lose should they try and debate it.
We want to shut it down, and that should tell New Zealanders everything that they need to know. I'd also add that in the government's first 100 days, one of the first things that it did, as quietly as it possibly could, was revoke or repeal the enabling legislation to require IRD to report on the fairness or unfairness of our tax system. I wonder why that is.
I wonder why that is, Chewy. Do you have any ideas as to why that is, Chewy? Any ideas?
Some rats don't like being put in a spotlight. Because if you've gotten a rat in a spotlight, you can find out where it lives.
Yeah.
And then you can do something about it, like tax the shit out of the rat.
Oh, taxing the rats. That's interesting. I wonder how we do that. Hey, let's have another chat about this conversation because, you know, New Zealand has, and I know it's a horrible kind of small world mind that punched above its weight, the plucky little country, but there have been things in the past that New Zealand has certainly led the way and held the line. We think about the no nukes in the 1980s, think about women getting the vote, these things that this little country is pretty famous for. And the host again, and I'm sorry, I don't know the host name. I did put it in the show notes, so but I forget it. Kind of ask, can New Zealand take a leadership role in the world around tax? Like, can this be a place that shows everyone else how it's done? And it's a good question to ask someone like Chlöe because, you know, it's those leftist issues that we seem to have, you know, led the world in the past.
I mean, we absolutely could be taking a leadership position if we wanted to. Unfortunately, I think with this current government, we're seeing far more of a shredder than we are any kind of vision for the nation that we'd want to build. And this is a point that I made in the budget debate, you know, this kind of cut after callous cut, whether it's in conservation or the front line of what's necessary for communities or climate resilience or adaptation or whatever. It's not only cruel and unusual, but it's not how you build a country, it's how you break one. And that's where I kind of come back to those basic economic principles. You know, it's really deeply ironic and profoundly nonsensical for the government to be talking out one side of its mouth about productivity and growth while actively kneecapping precisely those things with its fiscal strategy, where it is pulling back on government investment and the things that drive that productivity and that growth, let alone fair distribution of those things. But to your question on how our tax proposals would work, so we've put on the table a proposal for a wealth tax, which would only apply to the top approximate 3% in this country. So for anyone with an individual net wealth over $2 million, so for a couple it's over $4 million, and that's net wealth, so it's minus obviously your mortgages or otherwise, you'd pay a 2.5% tax above that $2 million net wealth individually. And doing that, along with a suite of other reforms and using debt sensibly to actually pay for productive investment in our infrastructure, as opposed to the tax cuts of Nicola Willis, which have generated 0 jobs and in fact have only continued to minimise the opportunity for young New Zealanders, we can build an economy that works for people and planet.
Let them fight, Chewie. Let them fight.
What I want you to do is the next time Seymour or one of these right-wing chuds decide to describe Chlöe as being a radical, I want you to rephrase that in that she's radical in the same way that someone doing a kickflip on a skateboard is radical. Because that's where I'm at. I'm like, yes, all of that, please, now.
I mean, okay, so I'm going to speak back to you, the imagery I get when you use that kind of radical. That means high skill, nails it, difficult, but is able to function in a way that most people can't, and is an impressive athlete to all who are watching. That kind of radical.
Yes.
It's an analogy.
And
it's an analogy.
Like, everything she spoke about there is achievable. None of it is like moonshot stuff. But that is how David Seymour and the National Party speak about everything that the Greens put on the table. Oh, it's just pie in the sky stuff. It's all good in theory, but it'll never happen. Like, none of that is crazy future utopia stuff. It's all within reach.
Yeah.
And this is the thing that drives me batty, is every time that they put something like this out there, the media seem to, like, sure, they'll give them a platform to talk about it, but then they do nothing with it. They don't turn around to some of the bigger parties and go, hey, look, this seems all perfectly reasonable and will give us access to some things that people really, really want. Your parties are doing none of it. Why? You know, and certainly for our friends in Labour, copy her fucking homework.
Yeah.
Just wholesale. Just run with it. Or do the thing that I've been saying where you go, you let them push the boat out and then you support them doing it. Like, rather than go, oh, well, you know, crazy old Chlöe, No, we want you to be a party for the people, a party for the left, and running to the space that National occupies and trying to push them out of that space is not a winning strategy in this man's opinion. I'm the man with the opinion.
Oh, it's your manly opinion.
It's my learned opinion. And look, let me tell you, as a middle-aged white man, my opinion has some weight.
I know. I think you middle-aged white men, you've been too quiet for too long. I do really think you should step up now and start making some noise.
Nobody ever asks us. We just do it.
Yeah. Yeah, I reckon there should be a group for you. You should have a march, I think, Chlöe. What colour would your flag be?
Some sort of association. Well, obviously.
You should have a march and your flag.
Nobody.
You could probably then convert that flag into like something that you cut eye holes out of as well. Is that about right?
Look, people get nervous when large groups of white people organise. It historically hasn't been a great thing.
Arvid says that the show could be called The Big Hairy Front, which sounds a bit wrong to me.
And then on Sunday we can have The Big Hairy Behind.
It's Chelsea Daniels. Credit where credit's due, Chelsea Daniels. Another thing for you as well, we've been talking about Gary's podcast and stuff. If people haven't picked up on it, let's show the introduction from today's show, because then you'll kind of see what it's about. This is the introduction to the show that came out this morning.
It's so crazy, this idea of mandatory overtime.
I can tell you, particularly in the theatre setting, if surgeons want to push through a case that's getting a little bit later in the day, and you're halfway through a case, those nurses can't walk out of a case, obviously. So the expectation is the nurses will stay in there, finish that case, but will not be paid the overtime. So you're forced. They have now put in a new thing in theatre where the education sessions will be at the end of your 8-hour shift. You will not be paid for that time. Even though it's your time, you're not getting paid for it anymore. So it's little situations like that. Obviously, if there was an emergency and you're doing CPR, of course you're not going to leave and you don't get paid for that. Fine. But it's the cases where management will just go, too bad. You have to do it. So it's mandatory, but not paid.
So there you go. Dr. Gary Payinda's podcast. That's the introduction to this morning's episode. You can check it out on the YouTube channel. You can check it out on Apple Podcasts. You can check it out on Spotify. And that's today's podcast that has just been put out, Joey. Very good. It's very, very good.
I'll say it every time we play it.
I highly recommend it.
I'll say it every time we play it. The titles, they go hard.
They are fire. All right. Oh, anything else in the chat you want to get to? There's a few that you have starred. Do you want to get to those ones? And then we'll move on.
Very short says, the other thing with private, any post-op infection after being discharged from their hospital that requires urgent intervention, where do they go? Straight to the public.
Yeah.
Labor need to come out and say they will reduce any 10-year contract funding to zero if elected. Yeah,
I'm interested. So this is a question we need to ask Aisha or someone from Labor, because are they able to cancel and negate contracts? Because if they can do that, they should be saying that about the drilling in any public national park. Your contract will be cancelled. I do wonder if you then get stuck in a situation that you may be culpable for a huge amount of money. But look, I'm down for the idea. I just want to know, is it actually legally possible? But mind you, we're going to talk about Trump in a sec for about 2 minutes. If you want to learn from anyone how to do things that aren't legal, yet they still go through, just follow his lead. So be interested to find out. Anything else?
No, that's everything for now.
It's been a hilarious weekend. Hilarious is probably the wrong word. In America, watching what's going on with Jeffrey Epstein. Now, you have to remember, Donald Trump and all of his influences right? All the way through for the past 3, 4, 5 years, Jeffrey Epstein's list. He is in part there because of the influences that pushed him and this narrative around Jeffrey Epstein. I think this was either Friday or Saturday our time. I'm sure many of you have seen or heard it. You can hear him kind of going, who is this person? I haven't heard of this person before that he was best friends with for 10 years.
Are you still talking about Jeffrey Epstein? This guy's
Epstein?
Like,
Epstein?
like even the emphasis on the name is like, I think his name's Epstein.
Am I
I'm
saying
not
it?
sure.
Is this how you pronounce it? Is it Epstein? I'm not so sure.
Epstein? This guy's been talked about for years. You're asking, we have Texas, we have this, we have all of the things. And are people still talking about this guy, this creep? That is unbelievable. It just seems,
your friend, the creep.
Like a desecration.
So speaking of Texas, I saw some facts and figures over the weekend. You know, Kristi Noem, who's in charge of all that, she brought a rule in that you could not move forward. This is the group, I forget the name of the group who is in charge of disaster relief. Anyway, you couldn't action anything if it crossed over the $100,000 threshold. So what happened with the floods in Texas is within about 6 seconds, they had gone past the $100,000 cost situation. And so they had to get approval from Kristi Noem to spend any more. And it took her 71 hours to make that approval. And they're wondering why there were so many deaths. And they're wondering why the government they have now let them down. This is something that I've been following quite closely over there. And here's something else that happened to you. Now, I'm assuming this is the World Club Trophy, the World Cup Club Trophy. I think this is like, you know, like the best team in Europe plays the best team in the Americas, or best team in England plays the best team in Europe, like the UEFA Cup sort of thing. Trump wasn't supposed to be there. And
this is the cringiest thing I've ever seen.
This is the cringiest thing you will ever see. As he pushes his way into you even see the person who goes with him tries to drag him off. Anyway, he just stands there amongst the team celebrating. Have a look. If you're gonna, okay, sheesh, stuff is screwing us around. Hit refresh. Is it still there? Play now.
Boo!
Yeah,
boo that man!
A huge number of boos. So here's the ceremony. Congratulations, well done, well done. And, you know, in a ceremony, you give them their award and you get the hell out of the way and you let the athletes have their moment. But would Trump let the athletes have their moment? You see the man on the left, he'll definitely get out of the way. He'll try and move Trump, but...
no, I stay.
No,
I'm a big fucking
there.
Gumby. Look at the guy behind him going, what the fuck?
Yeah.
I want Trump in front of me.
Trump's
what a
still
goober.
There. Trump's still there.
And then in comes the FIFA guy and then just pushes him back through the... like, it's so bad. Yeah. It's so bad.
And this Jeffrey Epstein thing, like we said this last week, don't get your hopes up because he's had so many chances to have his base leave him and they haven't. This has hung around for a week. And on the timeline of Trump, a week, can we say it, is a very long time in politics. And so it'll be very interesting to see if they do continue to stay away from him. We'll see. All right, Chewy. Hello, dog.
It is hurting him.
What are you doing, mate?
It is hurting him in a way
Come here.
that I don't think anybody really expected. Like him getting ratioed on Truth Social in the last couple of days. That's never happened before. But people have not forgotten this. And every time that they try to spin it to the Democrats or people on the American left, the people on the American left are like, yeah, like if any of our team are on the Epstein list, we need to know.
And
like just let it. Like I saw someone try to state the point of like, well, maybe they can't release the Epstein list because it would completely destabilize our country. Like if someone said that here of like, look, we can't possibly because this list is full of pedophiles and we wouldn't be able to run New Zealand without them. I'd be like, if if the guys running the show are all pedophiles, we don't deserve it to run.
Yeah.
We need to get them gone.
And the things that they're coming up with, Trump's like, you want to pay attention to this list written by Obama? And it's like, hang on. If Obama organized the list, the Epstein files, then why wouldn't it have been released? You know, like just every excuse under the book that they're coming up with. And I mean, I don't know. I don't know what'll happen from here, but it's hanging on to him longer than anything else has so far. We'll talk to you in a month, see if it's still hanging around, but we'll see. All right, hey, let's move into the last topic of the day, and this is going to be a bit of fun, Chlöe, because we've got a little bit of unknown quantity here. So this is the story about the long-term changes needed to bail out natural disaster responders. Christopher Luxon. I had some RNZ stuff set up to play, but I just noticed 3 News have done a bit that says flood hit Nelson, Tasman will become test case to end government bailouts.
Oh.
I haven't seen. I haven't seen this
shit.
yet. So this is like
farming sector. Are you paying attention?
Yeah, very true. This is like doing the high wire with no safety net because we don't know what they're going to say. But the heading has caught my interest. So let's check out what Sam Hayes and her team had to say about, is this the end of government bailouts? Thanks to stuff.co.nz.
Haere mai, welcome to 3 News. The days of the government bailing out properties written off by natural disasters might soon be a thing of the past. It comes after the Nelson Tasman region's been...
Well, might soon is carrying quite a lot of water there. There was a report last week that said within 20 years, but you know, might soon might be doing a bit of heavy lifting there.
Hit with floods and slips numerous times in a 2-week period, with hundreds of homes damaged. Locals want help from central government, but Prime Minister Christopher Luxon says bailouts aren't a long-term solution. Lloyd Burr reports.
Oh, I wonder what it is. What do these guys think about climate change and putting things in place? I wonder what it possibly could be if it's not bailouts.
Crops ruined, bridges destroyed, silt, debris and gravel everywhere, paddocks that have become lakes, homes completely wrecked, some moved to entirely new locations.
Wow.
It's been relentless and it's taken its toll.
People are exhausted, tired, frustrated and in some cases angry.
It prompted this Facebook post from Civil Defence, reminding people to be kind and patient. Inspectors have been out over the week.
Can you imagine how all the anti-vaxxers reacted to that post? Be kind.
Yeah, there's a lot of them up there.
Just imagine.
Many for the second time in as many weeks.
Red stickered is 4, white stickered to maybe 25 to 30 and a similar number yellow stickered, so all impacted to varying degrees.
Tasman Mayor Tim King says those numbers are almost guaranteed to increase.
This is shocking. We haven't really covered this very much, and that's probably our bad, and also acknowledgement of so much news going on at the moment. So this is the time to, just acknowledge the difficulty people are going through as well. And I mean, we'll get into the conversation around what should the government do, but I know where I'm sitting already.
But concerns are brewing over whether the government will bail out written-off properties anymore after this from the Prime Minister this morning.
The government won't be able to keep bailing people out in this way. This is a long-term issue. We need a proper framework in place to work out whether it's landowners, whether it's councils, whether it's central government, banks, insurers, that actually have to create a framework for dealing with these sort of weather events.
And someone has to be the first not to get the assistance that perhaps has been offered elsewhere. It just sucks if it's going to be us.
Asked to clarify, Luxon this afternoon said this.
At the moment, we'll come out of the response phase. Then we'll have an assessment of what other support may or may not be needed and how that may happen between central and local government. But that's a conversation for later.
If the government won't pick up the bill afterwards, the Insurance Council wants it to pay for preventative measures.
If we know we're going to have more flooding, extreme weather, landslips in the future, then there are things we can do to get ahead of that. I think most people would agree we'd rather get onto it beforehand rather than spending money to bail out.
Oh, really? Like preempt something happen rather than like that's such a unique idea. Like putting money into preventative stuff. Like I wonder if there's any other places we could apply that, Chlöe, like within the justice system. Do you think they could put some of those stop banks up in the justice system, the preventative, spending money there rather than... See, this government can't on one hand start floating the ideas about not bailing out people when every other policy they have is always at the bottom of the cliff. How come all your other policies are at the bottom of the cliff? There's nothing preventative. Yet now you're going to try and go preventative for this one. Is it just because you've spent a whole bunch of money on tobacco companies, landlords, and tax breaks? Is that maybe that's the reason? Maybe that's the reason. This has just got 30 seconds, yeah?
Communities after the fact.
I've spoken to other leaders around the world about this issue as well, and no one's any further ahead of us or got any ideas because they're all wrestling with the same challenge.
It still leaves quite a vital question.
The complicated questions around climate change adaptation is about who pays for what, actually. So everyone putting the ball to the different groups, and no one seems to take a responsibility.
I would like to think that there is a transition and that we're not going to be the kind of guinea pig. But yeah, I'm yet to get that reassurance.
Hopefully not a guinea pig, even if parts of the region look like a pigsty.
Oh, God, Lloyd, that was a terrible pun at the end.
Oh, why would you do that?
I cut the video off. I wish I'd cut the fucking sound as well. I've got another video to play, Chlöe, of a couple of young upstart commentators from about 18 months ago. But it does. Well, in fact, we don't need to talk about this because I think these young upstarts are going to talk. I mean, maybe I'll just play it now because then we can respond to both things. We do that. It's only 90 seconds.
Let's do that there, Pat.
18 months ago, there was a couple of young upstarts. I'm not sure what the show's called. It's something like PMS or something. I'm not sure what it's called. And they were talking about when a government decides to empty its coffers, where is future money going to come from when there are natural disasters? Whoever these guys are, they were on the button, man. They must get some credit sent back to them from now because they speak the truth. He asked an interesting question. I just want to play this question. It's only about 30 seconds and then we'll talk about it.
I guess you've got money set aside for disasters like this.
That's right. And look, our focus at the moment is on the response on the ground. Our emergency management minister, Mark Mitchell, flew down last night. I understand there are 135 first responders there today, along with multiple helicopters and aircraft. So we wish all those responders the very best as they work to get out the fire. And we're just so grateful that no lives have been lost or anyone injured at this stage.
Now, I think it's fairly obvious to say we're all definitely, thinking about the fire and hoping the best for it, and we're happy for the government to use public coffers to help in that area. That's what we do. That one question made me think of two things, Chlöe. All the people who are like, why should I care about the council next door's pipes? My city's made up for it and got their own. Then you go, okay, so fuck you, Christchurch, look after the fire yourself. It's not how we operate. But the second thing was, Lloyd's question was, we've got money set aside for this, eh? And she said, yep. Here's a question. How do you get money set aside, Chlöe? You get it by having a surplus, by having something left over to be able to put aside, not running a zero balance budget, giving all the money back to landlords and stuff, and not having some left over to put aside. And when I heard him ask that question, and Nicola Willis going, oh, yep, we've got money set aside. Okay, thanks, Labor, for that money set aside, because those are the ones who set it aside. But what about this government reducing a whole bunch of income coming to the government? And we said this before the election, Chlöe, for the next disaster. Yours, sir. Well, I won't go yours, sir, in there. And we are taking note of the magnificent beard, Chlöe. Were you all jealous about the size of that beard you had then? Is there anything
Not
you
like
like?
I live in a coal mine and I travel to the podcast on the back of a train.
I can remember pre-election us going, if everything goes perfectly for the next 3 years, if for some reason there are no natural disasters, this government might be able to skate through on the financial decisions they're making with these tax cuts, with these reimbursements, with these tobacco company, reimbursements as well. But they've had about 3, if not 4, and there's no money to be given. And now that there's no money, they're talking about, should it really be the government that bails them out? If if we're a couple of rodeo clowns, if we can fucking see it, surely everyone else can as well. Surely this is, if you voted for this coalition of chaos, this is a part of what you voted for. You opened up the door. You are somewhat culpable, Chlöe.
I am not catastrophizing when I say that these weather events are going to get more frequent and more intense. That is just a factor of the ocean heating up, which every scientific metric is pointing at. The atmosphere will get wetter, storms will get more intense. The other thing is, we're still waiting for the southern fault to just lose its shit and demolish a couple of major cities. This government looked at a climate mitigation fund or a climate response fund and goes, here's a whole bunch of unattended money that we don't think we're going to need. So we're just going to funnel it to landlords, and now it's gone. And what do you mean that Nelson has flooded consistently, or the Nelson Marlborough area has flooded? Is it 3 times? 3 whole weeks of rain, 2 major floods, people getting taken out, and the Prime Minister was away on holiday. He was away on holiday. He's only just come back. Not for the people of Nelson Marlborough. Sorry, not important enough.
Well, I know
to break a holiday and come back and be a fucking Prime Minister.
Okay. Yeah, you can come back, but I think it was obviously you can't plan a natural disaster. But just side note, what you can plan is avoiding the regulatory standards bill going through, Chlöe. Just saying.
Yeah, well,
that was last
obviously,
week.
No, and anything to keep fucking Seymour away from the reins of power. But this is something that our previous government had planned for.
Yeah.
They had something set aside for this sort of thing, so you had an instantly accessible pile of money that you could go in and go, cool, we need to do this instantly, and it's done, and then we replenish the pot over time. That's just good planning.
Yeah.
That's what I do in my house, that we have a pot of money in case my hot water cylinder explodes or my roof flies away or something like that. That's just prudent. Anybody that's in business would know that that's a good idea, to have a contingency fund for when the rubber band breaks and your servers fall over.
Mm-hmm.
Why can't our government, the party of business, big jobs, big portfolios, not understand that very basic rule of operation? Like this should scare people, that our Prime Minister is that cavalier about major flood in an area. What happens next when it's Dunedin?
Yeah,
You know,
and I did
or
say
a more
something-
important city in the north.
What? No more important cities.
It's always in the north.
I did kind of poo-poo the idea about it happening quickly, because this report that was a 20-year, talking about in 20 years. But you have to say, the way he spoke on RNZ and the way he then clarified, he was basically going, well, we can't do this forever. So he certainly made it sound more immediate than that report was. And as you say, Chlöe, oh gosh.
I've got big people doing big jobs and big portfolios.
There you go. Except for him, he has no portfolios, remember, as people have pointed out in the chat tonight. I just can't get over, all of the things we said, like not relating them to Trump, but there are a lot of people now in America going, no, he didn't say just the bad people would be going. He talked about mass deportation. You don't have mass deportation with only violent criminals. You can't. It's not just the violent criminals that make up the numbers to have mass deportation. He told you what they were going to do. And I guess the difference here is Luxon didn't tell you what they were going to do. We didn't know about Smoke-Free 2025. We didn't know about the tax breaks. We didn't know about the landlord reimbursements. None of that was guaranteed. But we told you. And many people on the left told you the kind of things that were coming. Ruth Richardson 2.0. So I guess it's slightly different in that you don't have to believe them, but maybe you can believe us next time, as much as it sticks in some of your craws, and you think that we're partisan. And yeah, I mean, there's not much that we've gotten wrong so far this cycle. Maybe you can at least listen to us. Yeah, didn't know about the ferries, says Mike. Didn't know that stuff. They didn't make promises, but we know the flavour, right? They might not have told you how much the ice cream costs, but we know the flavour of the ice cream, and it's fucking bitter. You don't want any of it.
It's poop. It's poop ice cream. Look, we'd be much happier if we had earned the reputation of New Zealand's least accurate podcast.
Yeah,
we're constantly getting it wrong, because by Jesus, the country would be in a better state than it is now. But as it is, I want to wrap up the show by saying, you're not going crazy. Shit's repeating, and it's repeating in the form of Winston Peters. You'll like this, Pat, because Winston's your favourite, right?
Okay, he's my favourite.
So someone I follow on Blue Sky picked up a book from the Paikakariki Book Fair. It's from the 90s. It's a little cartoon book, the 1993 Cartoon Annual from the Evening Post by Tom Scott. And it's all about Winston and what was going on in the early 90s. So let's have a wee scroll through and see what we recognise as happening now. Real New Zealand heroes, unemployed youth who keeps looking for work. There's not many jobs on the board there, so that's good. Privatise the system, that'll fix it. After the worst power crisis in recent memories, averted only through the sacrifice and common sense of ordinary New Zealanders, that and Electricorp being able to coordinate hydro and thermal generations across 2 islands, what lessons has the Minister of Energy learned? Sell all of it.
Good grief.
What situation are we in now? Winston, he should have been in a rest home at that point. He's still not in a rest home now. But he's saying that last night's indoor bowls tournament was rigged, and he demands a full inquiry.
That was 22 years ago. They said he was too old for the job. No, 32 years ago. That's 32 years ago.
Yep. The passage of time is a real motherfucker, Pat. Here's a good one. Economic austerity and stagnation following the 1991 mother of all budgets. Another forecaster confirms the economy is growing. He's confirming it through a microscope. Sound familiar?
Yeah, far out.
Are we ready to put our heads through a wall at this point? Yep. Look, global health threat, holes appearing in young men in Serbia, Bosnia, Iraq, Georgia, and South Africa. Barbarism is leaking out of the civilization layer. Palestine.
Oh, God.
Fuck me. 1993, this is from. Weren't we just talking about the mower?
Yeah.
This book is spooky and I would assume cursed at this point. Health reforms. Let me get this straight. You're a 22-year-old Treasury economist and all the changes to the health system were entirely your idea. Not entirely. Teddy helped me out a lot.
And he's 32. And he's a banker. He's a bank teller. Change that to a 32-year-old bank teller and former anti-abortion activist at university. And it's the same story.
Back then in 1993, we were talking about genocides. That was in Bosnia. Ethnic cleansing, that was the term that came up then. And we're still talking about it, just in a different part of the world. Yeah, and that rounds out that, as I said, cursed artifact from 1993. The world turns, we still talk about the same bullshit.
To wrap up with a nice thought, Ken says, if Labour/Greens win the next election, Chlöe should be Deputy Prime Minister. I'm interested to see what happens at the next election and if they get a chance to form a government. I mean, like, the Greens have history of helping form a government but wanting to be outside cabinet. So it would be really interesting to see what they see. We've spoken to Chlöe on the show a couple of times, and I think it was her, and I kind of said, you know, is the objective to be the big boys and girls on the left, to be the big party? And it's like, yep. So, you know, if you're aiming at some stage in the future, 5, 10, 20, 50 years, who knows, to be the big ones on the left, then at some stage you do have to be in cabinet, and at some stage you do have to be in one of those two positions. So, yeah, be interesting to see.
The Greens have not done anything yet to dissuade me from voting for them.
All right, team.
It's theirs to win.
We are going to wrap it up. Thank you for being with us tonight. A big thanks to Gary for jumping on board. Remember, Gary's podcast episode was out today. There will be more out later in the week as well. Another one on Friday. There might even be another couple out. So make sure you either subscribe here to the YouTube channel if you are watching us on YouTube. If you're watching us on Facebook, get across and subscribe to the YouTube channel. Or, of course, you can subscribe to Gary's podcast on Apple Podcasts, Spotify. If you subscribe on Spotify, you do actually get the video version of the show because Spotify does video now. If you subscribe to the Apple Podcasts, where it's number one again today in the medicine category, you get the audio version of the podcast. So thank you, team. It's been a really good show.
Help us settle a debate, whether it be thoughtful or funny, even if we're all creatures of hate. It's a fine line that we're walking together. For better, push aside the temptation to berate. Let's take a note of the corners we stand in. As many points as the hairs on my chinny chin chin. When the news that we're watching is hairy, knowing all the things that we need to be wary of. Like the rich have the hand out for rewards, while the many have to work out what they can't afford. And the rest of us ain't paying attention, or maybe have questions we're too worried to mention. Other media is still dwelling on trivial facts, vetting bees from the rice and the mice from the rats, and picking and choosing a warpath to run, and linking ourselves with the hill to die on. It's gotta come down to a welcoming vibe, with an A and a self and a higher in mind. All heavily, neither this way or that, and will be analyzed by butchery and pat. With the evil in the world trying to mess with your head, and you're sitting on the couch, you're thinking chivalry's dead. Each night, 2 nights, they're gonna sing you to bed. It's Big Hairy News.
Nothing else from me tonight, really. Chew, you got anything you want to add to the show? End of the show?
I've been put on the spot, and no, I don't.
All right. Thank you for being with us. Thank you for being a part of what we do. We will see you tomorrow night from 9 p.m. for our next edition of Big Hairy News. Hooroo, team.
Cheers, fam.